with Johannes Lynn, have had the pleasure of launching and chairing this community of practice for the 7 years it's been around. To call it a labor of love would be an understatement. And we're now, from the mighty 20 or 30 or 40 we were when we started, we're something over 2,000 from 400 plus organizations all around the world. Happy to say now about a third of you are calling in from and reside in the global south, which was not the case at the beginning. And we have 9 very active working groups, all of which you're welcome to be a member of. There's no charge for anything, and that we're better for you. So please join us if you haven't already done that. At the end of the session, we'll give you information on how to do that. I'm going to say just a couple of words about the community of practice and then give a little preamble to the session today, then hand over to my co-chair, John Floretta from JPAL. The community of practice early on decided that it existed primarily, but not exclusively, for the benefit of the members. So the idea in this community of practice is that it's as close to a true cooperative as I've ever been part of. Namely, people give what they can give and they take what they need from this. But we've also, in more recent years, tried to be influential with people beyond our own numbers. So we've picked a few issues that we think we can make a dent on and maybe move the needle. And I'm going to list the ones that have been most prominent on that. The first one we looked at was just trying to map the field a little bit in terms of what were the critical cross-cutting issues in scaling that were not particular to one sector or another. And there's a paper on our website that tries to identify what we thought were the 12 most important cross-cutting issues based on quite a large number of webinars and consultations inside the community of practice. Next thing we turned our attention to was trying to relate the discussions about scaling to the discussions about systems change, because there was a lot of back and forth. We knew there was a lot of overlap. We also knew that there was a lot of miscommunication between those two communities. So we tried our best to straighten that out. And again, there's a paper on our website that tries to do our best at that. The third one we looked at was the issue of principles and lessons. So again, trying to look across the community of practice, what could we say with any confidence had emerged by way of either principles or lessons? And in this case, we were hoping to get those principles and lessons socialized beyond our community of practice and into the kind of the thought process, into the Gemeinschaft of people who look at this issue in a variety of organizations. And the fourth one, which is very much ongoing now, is what we're calling mainstreaming. And mainstreaming in this case means how do donor agencies or funders of any sort, including some of the implementing partners, actually integrate scaling into the core of what they do? What would that look like in terms of policies, practices, strategies, funding arrangements, and so on? We're very much midstream on that. I mention this because these are all things we'd really like to invite those of you who've not been active with us on to join in wholeheartedly. There is no exclusivity about this. It's really genuinely is a community of practice. So you don't contribute, we don't have anything. Within the community of practice, one of the 9 working groups is this one that John and I chair on monitoring and evaluation. And it's had a work plan too. Again, we've tried to identify, particularly in the last few years, a couple of issues to take deep dives on. Everything I'm going to mention has some presence on the website, but we're also happy to share additional information if you're interested. The first thing we focused on was trying to say, what's the best way to think about the monitoring, evaluation, evidence issues involved in scaling? And we ended up emerging from that with a 3-tier framework about the kinds of M&E issues that arise at different aspects and different dimensions of scaling. That was one, call it a product. Second thing we looked at was an issue, a question, which is how should donors think about pilot projects? Or not just donors, how should anyone think about pilot projects? And what portion of the budget of pilot projects should go to monitoring, evaluation, learning, and communications? We ended up concluding that contrary to the 3 or 5% that donors typically fund earmarked for that, if it's a pilot project, the principal purpose is learning. And we thought as a community that 20% was a more realistic target for budgeting for those functions within things that are ostensibly and demonstrably pilot projects. Third thing we looked at was scalability assessment. And the issue was, how can you judge either before or during what the chances are of something being successfully scaled and where the challenges are most likely to be, and how can we systematize that in a more or less straightforward way. And the fourth one is the one we're talking about now, which is what we ended up calling institutionalization. And institutionalization basically says often the pathway to scale begins with something that starts outside of government, often in an NGO or a social enterprise, but it has the aspiration of trying to influence what government does. So it's what we called outside in. And we knew in our heart of hearts that there was particular challenges to trying to do that, but among them were M&E challenges, which is what kind of evidence needs to be produced both to do that kind of intervention and to have its chances of success be as high as possible. So we did a series of what ended up being 6 webinars in the last 6 or 9 months around that issue. And we pulled that together in a paper. And the paper ended up, I think, summarizing a lot of what we thought we knew, but it also ended with a couple of very unresolved issues, and that's why we're here today. One of the issues, for example, had to do with how we deal with soft systems. I'm sure John and the panelists will say more about that. The second is how to get this kind of information really used by governments or into the system itself. How do we do something about information utilization, not just information production around us? Again, we didn't feel like we cracked that nut yet. So as a working group within the community of practice, we pledged ourselves to stay on this issue for a while until we can really drive it to ground. And so today's session is an effort to do that, to take it one more step, and we're not done yet. And I'm very grateful not only to John in helping me think this through, but to the 3 panelists who've agreed to be part of it. That's Shahed Alam, who's co-founder and co-CEO of Noora Health, Varja Liposvek, I'll get it right eventually, who is the Director of Learning, Measurement and Evaluation at Co-Impact, and Heather Simpson, the Chief Program Officer at Room to Read. And we've asked them to read, or at least give a little bit of thought to where we've gone so far, because we're trying to keep this trajectory going forward. And with that, I'm going to hand over to John to both share with you a thumbnail of where we came out in the earlier work and a little bit of thought about where we might go from here. Thanks, everyone.
Great. Thanks so much, Larry. And Gabby, you can go ahead and share the slides. And thanks so much to Shahed, to Varja, to Heather for joining us today. So what I want to do is just share a little bit of the background to the sessions that we did and to the paper that we wrote, introduced programs, and then we're collaborating with governments to scale programs through government systems. And so on the health side, we had last mile health. It was one of our key ones. On education, last mile, thank you very much, last mile health and living goods. And from a health perspective, from an education perspective, we had Young Love and Educate. We had a session from donors, and we also had a session kind of reflecting on the role of these intermediary organizations who are helping to transfer and integrate particular evidence-based innovations inside government systems. Next slide, please. And so based on that, we wrote a paper that summarized that, and I wanted to share that and also to share some of the reflections from that paper. So one of the big changes is that we saw a lot of these organizations were moving from like measuring the impact of a scaling program, so like looking at outcomes and reach and efficiency and cost, and shifting to like assessing how successful, once those models are transferred to a government system, assessing like how successful the government is in like institutionalizing the program. So we had a slide that kind of shows that looking at these characteristics of governance, of planning, budgeting, and finance, of human resources, infrastructure and materials, and accountability within government systems. Was there like low institutionalization, like emerging institutionalization, significant institutionalization, and full institutionalization? And there is an example. We had the theory of change from last mile health, which was like showing how 10 years ago they were measuring their success through like a direct service delivery focused model. So looking at recruiting community health workers, training them, equipping them, managing them, paying them. And now their theory of change looks quite different. So there's still those delivery aspects, but a lot of what they're also focusing on is strengthening the system in West Africa governments to advocate for and to build strong community health systems. And so like basically shifting from direct service delivery themselves to strengthening the community health worker system as a whole within governments, and trying to think of the right M&E framework to do that. A big theme from all of these sessions was that like people tend to think that like the path to service delivery to systems change, just like people tend to think of the path to scale sometimes, as being quite linear. But the underlying reality is going towards systems change strengthening is very messy, and in part because you're shifting ownership of the innovation to government, and then you're adding lots of variables of complexity. So, and thank you, Gabby, for sharing the paper. It has a few key components, and one of them was just noting about how these different like intermediary organizations, and when I use that word, I mean an organization like these NGOs that we featured, and like Noora Health and Room to Read, which you'll hear from today, trying to help to build in like a proven innovation inside government systems and playing an intermediary function to do that. That there's these collaborative engagements and ways that they're supporting the system. So that includes like kind of maybe what would be most top of mind, technical support on like design and contextualization of that intervention, support for implementation, support to monitoring and evaluation, but also work to like facilitate relationships with donors and researchers. It involves working at multiple levels. So not only kind of embedded at the capital or at the national level, but seen embedded to support service delivery, at the state or at district, other subnational levels. A sense of shared responsibility and shared costs, and kind of overall shifting, mindsets and capabilities within an organization that previously was doing direct service delivery to think and to walk in government's shoes. And so, the paper also reflects on that requires, these, nonprofit organizations, NGOs, these intermediaries, to develop a system-savvy approaches for institutionalization. So like on the personnel side, we know that champions at various levels are critical, political, policymakers, technical, monitoring, and learning, evaluation. We also know in many contexts they're frequently transferred. One of the thoughts that Angela from the Financing Alliance for Health had shared was like thinking about overseeing increased government financing of projects, like a maturity model for thinking about budget lines. So like, going from there's no budget line, but there's real in-kind contributions. There's a secured budget line, but it's not funded. There's like a funded budget line, and there's a funded budget line, which increases annually. So that was part of like their metrics to check if financing was being kind of increasingly owned by government systems, and what Room to Read had shared, and what Educate had shared was like on the policy side, did you see shifts? So they were focusing on the skills-based program and education system. did you see a shift where the Rwandan government was updating its own entrepreneurship program outside of the direct projects that it was doing together with Educate, as as a sign that the system was adopting these innovations more broadly? And we looked at, the paper time touches on 3 different aspects of looking at the monitoring and evaluation of this institutionalizing process. And so the first one is, supporting government not only to implement these models and these innovations and to own them, but also to own the monitoring systems to track whether implementation is happening in quality and create those feedback loops. And so,
hey, John, with apologies, we figured out how to transfer the projection capability to you. Do you want us to bother doing that?
No, I'll wrap up. I want to go.
Okay.
The biggest thing is
Okay.
I want to get to our speaker. So
Okay.
thanks for. I appreciate you sharing that. But I'll wrap up in a sec. Yeah. So building in like these monitoring systems. And so Mochepi from Young Love said, like, how do we get good actionable data in the system? How can we as a nonprofit like support government to do that? And so, Nan from Last Mile Health was sharing that part of this is developing shared questions from the government, helping to build data systems and monitoring systems to answer the questions that governments are curious about, to understand if that innovation is being implemented well. And then they also stress the capacity not only to collect the data, but to build in processes and systems to review the data that's coming in. So to aggregate it and to review it at both national level and local level. So it's not just data going up, but it's actually data being discussed and have a better chance to be integrated into program delivery. The second aspect of that we highlight in the paper is like M&E look of institutionalization, looking not at monitoring, but seeing these intermediary organizations playing a key role to build evaluation partnerships. And here's like the acknowledgement that in many cases, like our partners, the ministries don't have formal program evaluation units. And so a key role of these intermediary partners can help leverage their networks to domestic and international academic institutions and consultants to focus on evaluation. And that's something that we've seen the different partners do. And then this third element, and this is something that Larry mentioned, is just like the importance of considering both, hard and soft elements of institutionalization. And so maybe some of the harder elements would be around service delivery. Are we seeing, in the cases of Educate and Young Love, like increases in literacy or numeracy? But also, like, do you see signals of government commitment? Like, are they integrating, for Educate skills into the national exam? But on the soft side, are there champions that are in the system that are advocating, for the program and the partnership? At the frontline deliverers, in the case of the community health workers and teachers, do you see motivation and energy? Are they seeing the change? And so finding M&E systems that look at these soft elements as well. And my last point before I turn over to our speakers is, this got me really interested, and this is kind of why we spent the first half of this year trying to write some of this down, is on reflecting on the role of these types of intermediary organizations that themselves are moving from, direct service, and sometimes direct service at a pretty big scale, to collaborating with governments and systems change. And, reflecting that that's a new role for these types of organizations, and that it also highlights the importance of sound M&E. And thinking that it's going to be we've seen that for these organizations to be successful, having more flexible funding, non-projectized funding, to be able to be a long-term partner is essential. And so, this is a topic that I'm quite interested in, both institutionalization through intermediary organizations as a whole, but then also specifically kind of thinking about the monitoring and evaluation aspects of that. So with that, what I wanted to do is actually turn over to our speakers, and what we asked them to do is they fit quite nicely into our themes. So Heather will speak first and speak about Room to Read's kind of literacy and empowerment programs, tell us about their institutional models, but then give a few reactions about from reading the paper, like what resonated, what didn't, what might be missing. And so we'll have Heather share from Room to Read, we'll have Shahed share from Noora Health, and we'll have Varja share from Co-Impact's perspective, that has many partners engaged on these types of systems change activities and institutionalizing through government partners. And then I'll turn over to Larry to make a comment, and then we'll open it up for questions and answers in a discussion with the group. And our hope is that we'll get this reaction from kind of these intermediary organizations and nonprofits and Co-Impact as a donor collaborative. We'll probably do a second session in December where we'll be hearing it from the other's perspective, like from governments. And we do want to kind of stay on this theme as we progress with the working group throughout the year. So with no further ado, Heather, I want to turn over to you. So Heather's the Chief Program Officer at Room to Read. It's an organization that believes that world change starts with educated children. Heather, as Chief Program Officer, is responsible for the design, implementation, and monitoring of Room to Read's literacy and girls' education and gender equality portfolios and custom projects across 21 countries. So Heather, maybe ask you to speak for a few minutes, first kind of sharing Room to Read's own path on institutionalization, and then kind of reacting to some of the reflections that I've shared and were in the paper. Over to you, Heather.
Thank you so much, John and Larry. Really appreciate being part of this discussion. And John, you did a fantastic job summarizing Room to Read's mission and vision. So thank you for that. As John mentioned, Room to Read, we've been working for a little over 20 years now, and currently in about 20 countries implementing programs. We do focus on literacy and girls' education, gender equality, looking at those foundational skills and learnings that children need to succeed, both in school as well as outside of school. So for the young children, it's literacy, because we do believe that that is a foundational skill that helps them continue learning as lifelong. And then with adolescent girls, we're working with life skills and things like critical thinking and problem solving, as well as some content knowledge around adolescent sexual reproductive health and financial literacy, etc. When I think about Room to Read's scale work, we lean more heavily into the literacy side of things than the girls' education side, gender equality things. And I think that's for a couple of reasons. One is that the systems globally have created space for first and second graders to learn how to read in their schools. And they create space in curriculums, they create space in teachers' time and energy to focus on literacy. As opposed to adolescent girl gender equality work, this is very amorphous still, and a lot of systems are still failing these adolescent girls and their foundational learning that they need at a system level. So we're at different areas of entry when we think about scaling some of these outcomes for children. And it's a little bit easier right now where systems have created space on the literacy side. So when I think about Room to Read's experiences, there's three different areas. One in India, we're doing some scaling work right now in partnership with USAID and different state governments in India to scale up a pretty comprehensive literacy approach that includes libraries as well as teacher professional development, teacher training on an improved curriculum for literacy instruction in schools. And I'll talk a little bit about that just very briefly. And then the other two examples are in Vietnam and Cambodia, where governments have created space to scale an element of our literacy program, our libraries in those two places. As I was reading this paper, so many things were resonating with me. It is absolutely the case that Room to Read has had to play that role of mobilizing resources to fund some of these scaling and system integration efforts that didn't exist in government budgets. So, for example, in Vietnam and Cambodia, again, this is working off of about 20 years of demonstration, proof of concept, relationship building. The government in Vietnam was at the point where they wanted to upgrade their library standards for schools. And Room to Read was there. We were in the room. We were able to say, we're ready. We can come to you with our own resources, our own expertise, as well as some of our own funding to help you, A, reform your library standards, B, to help train your school personnel as well as ministry personnel, as well as help co-fund some schools for books, materials, furniture, monitoring and evaluation, etc. In 2 rounds of memorandums of understanding, one in 2016, the next in 2021, really focused on the system scaling libraries work. And those memorandums of understanding negotiations were really important, and especially this last one, it really articulated what activities Room to Read was going to fund and what activities the government of Vietnam was going to start funding, and at what timelines they were going to start funding the procurement of books, the procurement of items, and then even the training costs for this scale. That required Room to Read to think differently. So I have had to work very closely with my chief financial officer, with my chief development officer, so we could find those flexible resources in a way that is different from how we used to fundraise in the past, where we used to fundraise on help fund building a library. Now we need to fundraise for help fund our work in partnership with government as they are building their own libraries. And it is actually not an easy switch for an intermediary organization who was used to fundraising in certain ways and using and budgeting for those resources in certain ways. It has required us a lot of debate and internal sort of gray hair creating conversations to figure out how we think differently about our own budgeting, about our own memorandums of understanding, etc. The other thing that really resonated with me, among many things, this monitoring of demand for institutionalization from policymakers, from opinion leaders, from middle-level officials. Because Room to Read has in 9 of our countries, we have long-term staff who manage relationships. We have really relied on those staff members to be the eyes and ears and say, oh, we're ready to engage with governments, but or the government is opening up a door for us to reform the curriculum or to figure out a different coaching model, etc. But we haven't had indicators of our own to track the interest and help our team members say, we think you're poised to have a door opening, so we need to be ready for that. Luis Crouch sits on Room to Read's board, and he will often talk about a lot of system reform and scale opportunity as being in the right room at the right moment with the right information in the right format that can be digestible for those policymakers, for those budget makers. And Room to Read, we have not been great. It's still something we need to work on, of both the indicators to help us figure out when those moments are going to happen, and then also to create the staff capability and the right types of expertise to create system-facing communication, system-facing technical support, etc. So with that, I'm going to pause, but those were a couple of things that really jumped out at me as I read this paper.
Heather, thanks so much. And I'm gonna resist the urge to comment because so much of what you shared resonates with me, and particularly around thinking about financing differently and ways of building capabilities to be in the right room at the right time with the right information, that because you don't know when that's going to be. So I'm going to turn over to Shahed Alam. Shahed co-founded Noora Health in 2014. I was reviewing more of his background in the last few days, and he is trained as an engineer. He's trained in public health, and he's trained as a medical doctor. And Noora Health, which he co-funded, has been committed to driving home a big idea that it takes a family to improve how healthcare is delivered. They've been doing a lot of scaling work, which I admire, particularly over the last couple of years. And Shahed, with no further ado, I'll turn it over to you to share your experience and kind of reactions to the paper.
Thank you so much, John, for that kind introduction. And I'm really excited to know about this community of practice and excited to participate as we spend most of our time practicing. So it's really nice to step back and share some reflections. So I guess I'll start with a quick background on Noora Health through kind of the lens of the conversation today, and then share some reflections on the paper. So as John mentioned, at Noora, what we focus on is supporting health systems to better acknowledge family caregivers of patients throughout the process of healthcare delivery. So our program is typically called the Care Companion Program, though it's called different things in different places. And really the focus is to expand the care umbrella to include those who are closest to the patient's family, and also the community. So we believe that this type of intervention, this type of work, supporting family caregivers, needs to happen health system wide. It needs to happen at the point of care, as healthcare is being delivered by healthcare workers in healthcare facilities throughout the places that we work. So from the very beginning, this model and this program is designed to work alongside public health systems to support them in doing this essentially. So we work primarily with governments, state, local governments, and also national governments to really integrate this approach to how healthcare is being delivered in their facilities in kind of their existing ways. The kind of components of doing this, which might be helpful in knowing before I jump into kind of our scaling, is what we support the government in doing is first identifying what are those care practices that families need to be doing at home. We help support them in actually developing the technical content, the materials, the products that are used to be able to train families. We also help support their system, their healthcare workers, on actually delivering this training effectively to families. And then finally, developing the technologies that are required to support families once they're at home, and also healthcare workers to implement the program. And finally, as something that we don't partner directly with governments with, but perhaps through this, I'm thinking more how we should, is we partner with academic institutions to evaluate this concept for various health indicators. So formally, what this looks like is that we get into from the beginning of our work with the health system, we get into a cost sharing agreement with the government where they provide the staff time, the facility, logistics, and other resources that are needed to conduct the training. And I think one of the benefits of this model is that it is quite low cost in terms of it doesn't need too many additional resources or HR. It's kind of just reconfiguring things that already exist in the system. So a hallway, a waiting area, a TV that's lying dormant. We kind of put those together and staff time together to be able to train families. But those resources are the government's, and we have them commit them to the program. And then what we bring in is our design and product development, training, and other technical support. So that's kind of more formally how the partnership works. So we've been able to reach more than 2.5 million caregivers to date in partnerships with 7 state governments in India. About 4 of them have, we've replicated the model pretty significantly throughout the state. 3 of the states in India are quite, nascent in our implementation, and we also work with the government of Bangladesh. And to make life kind of complicated for us, we have kind of 3 ways of looking at scale, or rather 3 vectors that we have in scale. The first is geographic, which I've explained where we're in right now, and we're hoping to expand that over the next 5 years to include 2 more countries and several more states in India. We currently work in about 6 major patient condition areas. But again, to be something that's health systems wide, we need to be across more patient conditions. So adding those content areas, and also going deeper within levels of the health system, because primarily we started working at secondary and tertiary, so larger healthcare facilities within the government health system, but now we're working at community level centers and with community health workers. Again, the whole point of our different vectors of scale is that we recognize that and what we've seen is that a lot of programs and initiatives in healthcare are very siloed. It's driven across maybe a patient condition area, or like a point of care that the intervention comes in at. And what we really want to do is support governments in doing something systems wide. So that's kind of the overall approach. So I can share a couple reflections then through our experience on this paper, and again, so much of it really does resonate, and I've learned a lot just hearing Heather, you and John and Larry earlier, you all sharing. So the first and probably the one I'll spend the most time on is the importance of being participatory, because I don't think it's just something needed to design and implement something as a pilot, but it's truly the only way you get something to be ready for scale and throughout that scaling journey. And by participatory, I think the first thing that we've realized, it's not just about being participatory at the state capital or the health department level. It really is when we go to healthcare facilities, bringing that same mindset of co-design, creation to those contexts as well. And an example of this is how training of trainers is likely something that many of us do. And the way we approach this with our nurses, let's say at a healthcare facility, is not to come and bring them, a PowerPoint deck and a set of skills and processes that they need to learn and implement, but rather sharing with them that this is, this is something that exists, and we've done it before in other settings. And these are the basket of tools to be able to actually do this in your facility. Now let's come together and try to figure out what are the challenges of making this happen in your facility. What are some ways in which we could learn from you on how to improve what we're offering you in terms of tools. So that co-creation at the facility level for us and at the healthcare worker level is incredibly important, and I think has been a learning for the sustainability and ownership of the program. And really what this helps us do is not think about ownership as something that we transfer from us as an organization to our local partners, but rather something that starts there with them in the first place. And so I think it really just recognizes that capacity and wisdom that exists in the system. So and this is again not something that we started with. We did totally come in with more of an implementer hat, a training hat to actually kind of getting the work into new contexts. And the second kind of way of looking at participatory for us, I would say, is really recognizing the priorities of the government and understanding that even in the implementation of our work, there needs to be give and take in terms of how we support them in their journey. And one really kind of short example of this, which we've done, is one of the states that we work with, they approached us to help them implement a labor room quality initiative, which is very different than the typical work that we do. But of course, it's involved in improving health outcomes in the facilities that we work in. So we visit hospitals every day. So we decided to support them in kind of implementing that through the checklists and various processes that they have. And now, after doing that for a couple of years, what we recognize is that the program that we implemented in those facilities actually is something that auditors and others within the government recognize as something that actually allows them to meet the government's programs needs. So had we not kind of gone through that process and just dove into working on something that, you know, loosely felt aligned, but of course, like in terms of true kind of expertise and what we were doing, it was different. We wouldn't have, I think, come to the conclusion where we're at now, where at now even a policy level and a systems integration level, it's truly, you know, it's truly being kind of complemented in that way. So maybe in the interest of time, I can pause, but I can share a couple more reflections later too, John, if it's helpful.
Shahed, I thank you so much. I really like that, and kind of getting away from, you know, I think that is something that could be improved in the paper, this idea of transfer to co-creation. And one small point that you mentioned was just, you know, it was almost a side point, but like these different ways of reconceptualizing quote unquote training. And for your case, it's like, these are a basket of tools, and this is like, let's think together how they could be applied. I was in a meeting a couple of days ago, and it was thinking about, you know, also what we know about training and literature around training, of like doing things together, and the applied aspect of training, I think is important. So I really like this theme of participation that, yeah, I think that's a really nice pushback. Varja, over to you. We're really lucky to have you back in the working group again. Varja participated in an earlier session with a few other donors, and I'm really actually happy to have you in this session with Heather and Shahed, because I know that, you know, your role as the Director of Learning, Measurement, and Evaluation at Co-Impact, you know, did these partnerships with innovators and with scalers is a very deep part of what you do. And for the rest of the group who may not know Varja yet, she brings more than 2 decades of experience in organizational learning, both with civil society and with public sector initiatives. So Varja, over to you for reflection and comments.
Thanks, John and Larry and everyone. It's really great to be here. I'll take it as a compliment that I've been invited back. So that's nice. So I guess my reflections, I mean, I've just loved hearing both Shahed and Heather reflect, and my angle is slightly different, right? We don't implement anything ourselves directly. We are a funding collaborative, and we have the luxury and the good, the privilege of supporting partners like Room to Read and Noora Health, although we don't work directly, just to be clear, but organizations like these. So I'm going to just make 3 points that will both kind of reflect on our view as a funder, and also bring in some of the bits of the paper that you shared, John and Larry. So first, I really appreciate in the paper this mapping of the key systemic elements that you have, the domains and the building blocks and the phases of institutionalization. I mean, it really is something that we work with all of our partners to try to help to develop in their own context, because it's really actually difficult often for people to visualize and get specific as to what systems change actually looks like. Everybody talks about it. How do you change a system? What does that mean? But to actually be able to help people break it down into very useful categories and to think through, I think that's a great tool, right? And something that we would love to use. I think just as any other tool, it has to be held lightly and nimbly, and as a way to not as to plonk down and see how you can fill it out, but as a way to kind of help people to unpack and just articulate their thinking and come up with these outcomes that will work in their own particular context, right? So what we're hearing from our partners a lot is that, in these categories, the time to spend in one category, like the early versus the intermediate, it's not equal and it's not neat and it's not linear. It's not that you spend year one doing this and year two here. And sometimes they can be really condensed, they can be stretched, etc. Also, the progress across blocks doesn't proceed at the same pace. So progress in securing budget versus working on human resources versus working on monitoring systems, they don't all proceed at the same pace either, right? So, so I think what we've seen through our work is about a framework like that can help partners like the partners in this room to sort of identify what we call the levers. Like which of these systemic levers has to be pushed first? Like where is there an opening? Where do you go first? And it depends a lot on the context. So in the kind of systems that are well-resourced and more centralized, you may start with the policy and the regulation because that's where the appetite is. In systems that are much more decentralized and fragmented, you may start at like a subnational or province level buy-in and then work your way up. And so just to use these things very nimbly, I think. And the point I want to link here is that what I think would be a fabulous public good is that to illustrate how not only a collection of stories of how people do this, but to have examples that are guided by a common framework of how systems are strengthened by using a framework like this. I think this would be a public good actually, because we all talk about doing this, but we don't have anything that would kind of pull it together. The second point I want to make is about I really love in the paper this discussion about the roles of the NGOs, so the civil society, as being in this hybrid space, and that's exactly where we fund. We fund organizations exactly there, that they have a proof of concept of something, they have reached a certain scale, they have evaluated it, but now they're really ready to work with systems and with governments. And I think what happens is that what is not talked about so much, and I wonder what my co-panelists would say, is that this, being in this hybrid role often means a significant change for the organization itself. And so, because it's not easy to go from being a direct implementer to being a system level actor. I mean, I think you have to develop different capacities, you have to sometimes hire people, sometimes really reorient what you're doing. And so we really encourage, as part of the grant, part of the support that we give, is that there are significant resources dedicated to how the organization sees to growing itself, and not growing necessarily as being bigger, better, because it's going not necessarily direct delivery, right? It's like shifting. So how do you want to transform, and what are the resources that you need to transform? And I think investing in that is super important, and I don't think it's done enough. And so I think, I think I would love other funders. I don't know if there's any other funders in this room, but this is something that we talk about all the time. We want other funders to get on board with this a lot more, that it's actually that then what also needs to change is what you consider as a funder, what you consider as success, as what the program partner then tells you that they're doing. So you're no longer really expecting, I've reached X amount of people and I've saved X amount of lives. What you need to be comfortable with as a funder is that I'm working with government, I'm contributing to a significant process. I'm not the one who is solely in charge of it, because I've given up some control. And so I think, getting more people to come on board with this hypothesis, how do we prove that this is the way to strengthen systems, I think would crowd more funding into this space, which I think is really needed. And the last point I want to make here is that, actually, if you allow me, just a little tiny thing, is talking about soft components of the system. I just want to pick up on that. I just want to make an observation that soft components actually show up in hard ways. And what I mean by that is that, for example, it's like norms. The soft component is like how we do things here, right? And so it's the attitudes, it's the norms, it's the untangibles, but they show up in things like gender balance. And we see this as about, who's hired as a community health worker, or who's, receives a promotion or not. And so they're soft ways, but they have hard effects. And so I think that's something that we've learned. But the last point I wanted to make very quickly is that, as much as what I love in the paper, this unpacking the institutionalization and strengthening systems, I think the one link that I was kind of missing is, strengthening systems for what purpose, right? And I know it's implicitly there, but I think we need to keep driving it. And I think both of my co-panelists made that point really, really clearly about like what changes in people's lives. Like, we're doing this because we need to make a link to how people's lives are improving. There's lots of examples that we all know about where a system adapts and adjusts and actually doesn't improve people's lives along the way, right? So as funders, I think there's two really important ways for us to lean in. One is to absolutely support our program partners to work with government systems to strengthen their own measurements. So again, it's not the measurement of what the program partner themselves reaches and does and achieves, but how does the government system, whether it's a particular ministry or even the National Bureau of Statistics, I mean, these are such important actors, right? And it's amazing what happens when a system starts to see people with the people that they're intending to serve, right? When that is like at the core of what the system does, when that transformation is really powerful, and we have some great examples of that. And a corollary, a super important thing that I'm quite passionate about is that also I think one of you also spoke about this, partnering with others like think tanks or researchers and bringing those in both to kind of help you as civil society organizations, but also the government to kind of ask some of the harder questions. I think what we as funders really, I'm very much keen on doing is actually growing the field of global South-based research entities that can do this kind of work, because we too much rely on, the usual, sorry, John, I don't, the JPALs of this world, right? Which is doing great work, but I think having that capacity in the global South that is contextual, I think we need to do some more there. So sorry if I took very long, but I feel very passionate about some of these points. So thank you.
Varja, thanks so much. You did a wonderful job connecting to both what Heather and Shahed presented, and so I definitely agree with every point that you raised. So maybe, Larry, how about I do kind of think it would be nice to turn to, maybe I'll turn to you if you have a comment or two, and then quickly kind of turn, as we are a community of practice, hearing from our different members who are on the call today and encouraging folks to unmute, and maybe we could take a few questions. But first, Larry, is there any comment you'd like to make before we turn over to the group?
Mostly, I want to say thank you to the panel for a really thrilling, honestly, just wonderful presentations. I couldn't have asked for more in terms of trying to push this the next step. I want to just mention a couple of things that I take away from this that I think are worth underlining. One is that for us, it's often trying to scale up an intervention or a program or a project. For the system, it's just the new normal. So this is something that's getting integrated into a lot of things people are already doing. Sometimes it helps to brand it. Often it helps not to. And trying to figure out how the thing we're doing converges with the thing that they have been doing and are going to continue to do, I think is both a humbling and an important piece of this whole equation. It's not something that we as implementers and as service providers do comfortably or naturally, I don't think. Second thing I would say on the countryside, and we'll hear this, I suspect, when we do the next webinar where we have those perspectives featured. I think what we'll hear from the governments is that there's a real difference between countenancing something that's being donor-driven and embracing something which really is their own priority. And really to say the donors at that point, or the funders or the implementing partners, become agents of their efforts to try and improve something or do something. Again, there's a kind of a subordination in that, but a very attractive subordination as far as I'm concerned. And it has clear implications for how we look at institutionalization and how they look at institutionalization. The third or four points that I want to make is something that you all referenced, but I think we could talk more about, which is that from the government's point of view, the budget is the driving document on this. And so a major discussion about how things get on budget and what it means to get on budget and how we track the process of things getting on budget and where politics come into getting things on budget and how priorities get set. I think that's a big piece of this institutionalization process that if you approach it intervention by intervention, you don't quite get. You need to take a step back and look at the sort of the portfolio, the palette a little bit to get at those issues. And finally, one you did absolutely make, but I want to underline, which is that I think we had the notion of when things were going from outside in, that there was a handoff. But I think it's becoming clear it's not as obvious as a handoff. there's a kind of a sliding scale on this, and functions shift in a variety of different ways. And I think as we continue to deepen this conversation, it's going to be important to look at where and how that happens. I think that, Varja, you're absolutely right. There's a real sequencing issue involved in that that's very, very particular to circumstances. It's not a uniform pattern at all. That sounded like statements, which I guess it was, but I mean it to be questions back to our panelists and to everyone else on this. It just seems to me there's so much we can continue to drive as a community on these issues.
Thanks so much, Larry. And maybe what I'll do is just encourage folks who are on the call to raise their hands, or just feel free to unmute, and maybe we could take, 3 or 4 questions and then turn them back to our panelists and to Larry as well. I'll just give it a pause right now.
I'll just say that there's a very interesting long statement from Chris Harris Van Kuren in the chat box. She's had to drop off, so she's not here to voice it herself, but it would be interesting for the rest of you at some point to read it.
Great, thank you, Larry. And let me turn over to Noora.
Hey, oops. Hi, thank you so much. Thank you all for your great presentations. Heather, right now we're trying to institutionalize sexuality education in Madagascar. So as you're aware, system readiness is, yeah, it's tough, but we have a lot of positive points. But my question is, one huge challenge we have is that the big aid here and the bingos here, they're really feeling this norm of project-based, sex ed in our area of work. And our government partners, while they're very bought into the idea of institutionalization, they still are constantly being, like motivated by these project-based funds from these, donors. And I'm wondering, we have a donor on the call. Are you able to, talk to the UN agencies, talk to the USAIDs, and be like, please, we want long-term change. We don't want the $30,000 now because our government partners want their per diem. It's how do we get everybody in the room and kind of bought into this idea that let's make this a government line item. We have the buy-in. We just need to stop with the, the short-term handouts, if that makes sense.
Did you want me to address that, John, or? Yeah, okay. I mean, I'm sure there's others who have a view on this as well. I'll just share mine. So, I mean, thank you so much. I think it was Laura. Totally in agreement with that. I think there are funders, including us, who give long-term funding. So we give 3 to 5, sometimes 6 years funding. It's considerable amount of funding. It goes for organizational development, as I mentioned before, not only for doing the work. That said, I agree with you that there is the culture of sort of short turnaround project-based funding is absolutely there, and it's detrimental both to the NGOs as well as to government who's trying to pick this up. I think, fortunately or unfortunately, there's always this question about, well, show me why that's better. Show me, and some of it we know intuitively. Like, I think when you just sit and talk to people and you talk it through, it's like, obviously, if people are churning around on a 12-month basis and applying for funding and writing reports, there's hardly any time to do work. So obviously, but I think we also have an opportunity to prove the point about why is it that investing in long-term building of better institutions and supporting organizations in this way, why is that better? I mean, that's something that I think we as Co-Impact are keen to invest on, in order so that we don't come with just like, well, it's good sense, it's a good value, but to kind of actually have some of the evidence to back that up. So, I mean, I'm glad to talk to anyone who, who I can sway on this, because we feel very aligned with that issue. Thanks.
And Varja, and this question, Laura, also brings to mind, how do we make some of these elements that we are trying to scale sticky? And And yes, there's project-based swings that happen with big money that comes in. There's also government changes. When leadership changes, a minister of education who was prioritizing one thing, the next day it's someone else. So how do we make sure some of these things are sticky and can withstand the project-based funding, as well as those government shifts, changes of personnel? And that's where I think I don't begrudge governments accepting millions and millions of dollars. What I'm hoping we can figure out is how those millions and millions of dollars can continue building off of one another and the right elements stick through one to the next, even as some of these changes are happening. But I think there's an element of monitoring and evaluation that can really help with the stickiness factor to both identify what elements need to stick and what is okay if they shift around, and convincing mid-level managers, the government employees who stay even with shifts, as well as community members, family members, etc. So the demand stays there and can withstand some of these things. But I haven't sorted this out on exactly what type of data, what type of conversations, what kind of relationships we need to build to make sure some of these things stick.
Thanks, Heather. That's really helpful. I like this concept of stickiness. Shahed, maybe I'll ask you to respond to part of Chris's question, which I take to be that so often, in like the social policy space, government employees who are often overworked and kind of bombarded with lots of new and innovative ideas and priorities. And so for, at Noora, when you're thinking about these companion care programs and you're thinking about, working, with nurses and about how they might change how they engage with family members, and how do you kind of frame this so this doesn't yet become like, both in framing and in reality, just like another set of responsibilities that they're being asked to do? Like, how do you balance that when you approach this in Noora?
Thank you. Well, that's a tough question, and the first reaction, of course, at every level of our pitch, from bureaucrats at the health system level to healthcare providers, that this all sounds good: capacity building, health system strengthening, training, but this sounds like more work for me. And we're already incredibly strapped in terms of resources, time, all of that. And so I would say I'm just acknowledging that like bringing in this approach that's going to be the first, could potentially be the first reaction, and kind of then maybe push us towards thinking about things more on a project basis. But I do think where we've seen success really maybe just ties back to my initial point, which is giving, really understanding what are when we're talking about a nurse, let's say, understanding their workflow, their day, what are the pain points that they're facing, and seeing this approach that we have in training families as a way to alleviate some of those stressors. So for example, for us, what that has meant is, as a part of our research agenda, more on the qualitative side, but also we're trying to think how we can more quantitatively do this, is to show that if you run this program, that nurses' days actually become more efficient, that they save time communicating with patients and families in the long run. It'll help support them in that way. And also importantly, in their professional development and career advancements, things like that, because the type of things that we train them on, and also the type of kind of interactions that they get to have as a part of this program, it just supports them in progressing better in their careers. And so so really kind of, and that is not necessarily something from a health outcomes point of view, let's say at a health systems level, that someone would be asking us for in order to in order to be convinced about the program. But we know that to be able to go to the next set of nurses, to be able to say that, hey, this is actually going to be something that helps you, we have to come to them with some evidence. And so that's something that we've been able to gather, again, a little bit more qualitatively up until now, and share back with our nurses. And in earnest, of course, design the program so that that happens. Oftentimes we are given a decision point where we can do something that is a little bit more time or resource intensive for the system, or do something that's a little bit more efficient on both of those parameters, and it's kind of a cost benefit. So yeah, that's how we approach it, but would love to hear other
John,
takes on it.
can I add a point on the back end of Shahed's point?
Of course, yeah.
I really want to put an emphatic +1 on what he just said. It one of the observations I have about the difference in perspective between outside interveners and people internal to the system is that people who are outside are, in the best case, very, very, very focused on outcomes. In fact, the more direct the outcome, the easier it is for them to embrace it. But these things that are indirect in the first place, and secondly, are not directly outcome centric, are absolutely critical to adoption on this. I mean, think about if somebody said to your local post office, we're going to double the amount of mail going through the post office. How would the postal clerk say? Would they say, yay, we're really doing twice as good? Or would they say, this is terrible, we were having trouble keeping up with what we had before? So somehow, since the profit motive doesn't function as the filter it would in the private sector for this, in the public sector, it's indispensable to find ways to get inside the skin of the service providers and really make sure that this is a win for them, because otherwise the ability to resist the change is enormous.
Great, thanks so much, Larry. And maybe just, I know we need to wrap up and I want to be respectful of everyone's time. We had one question, which I'll put to Varja, that just came in from VG. And she says that, like, as NGOs or these intermediate organizations collaborate more with government, it gets harder to measure impact of the NGOs intervention solely, like I think she's kind of getting at that attribution. And so she asked that, like, since donors and funders want to know the specific intervention's impact, even does that mean that NGOs need to establish their effects as part of their proof of concept? So I guess the question I'm going to put to you a little bit, Varja, is like, how do you think about at Co-Impact, proof of impact, like maybe before a co-impact investment? So like giving you confidence, and that's probably not the only variable, that the program, if implemented, has a chance of being successful. But then when you shift to systems change, I suspect that you're kind of looking at contribution much more. But I'm just curious about how you thought about that.
Yeah, thanks so much. Great question. So for a lot of the investments or grants that we make, we do, we work with large established organizations that have already invested themselves into evaluating what they're doing. So they have this proof of concept that you're talking about. But by no means is that a one kind of a fit all. So some will have done large RCTs, some are working in spaces where that kind of quantitative measurement isn't actually particularly relevant or useful. And so we always look for a combination of things. It's like, what is reasonable proof of concept, right? And so for that particular issue, that problem, that population, we look at track record of the organization. Like, what have you, are you grounded in the context? Do you understand it? Have you been there for a long time? So it's definitely not only trying to look at this in a very quantitative way. Now, absolutely, once you start to kind of, transform it, and we talked about this before, how organizations go from like, I deliver, I can see the kind of changes, to now I'm supporting a system to do this. It definitely stops being from any attribution and becomes a contribution to something. And it's, and the hypothesis ends up having lots of links. Like, if I can make the system kind of shift in these significant ways, will the system actually do that? And I'm not the only force in it, right? So there's other forces that are either working with me or against me on this. And then does that mean that the particular things that the system is doing, whether it's in health, education, or whatever, actually will be done with sufficient fidelity, right? So that there is a plausible expectation that it will result in improved lives. And so trying to follow that, chain of cause and effect down the line becomes, interesting, but slightly less critical, because I think what we are looking for is like, can you get the system to behave in certain ways, and can you get the system to measure whether it's producing those outcomes? So absolutely, long answer to say it's contribution, not attribution, and it's contextual, and it's not just having RCTs, it's having like relevant, contextual, meaningful evidence of different kind of what is being achieved. Yeah, thanks.
Thanks so much for that, Varja. And please, everyone, please join me in thanking Varja and Shahed and Heather for a session I truly did learn from a lot. That's part of the reason that both Larry and I like doing the community of practice, is because we can share a little bit from our perspective, but then learn a lot from others. And so I appreciate all of you making the time, and I appreciate the great questions that were asked. If there is a slide, we want to encourage folks to join the community of practice and go out, and you can do that through the community of practice website. Thank you, Gabby. And you can also, if you reach out to myself or to Larry, I'll put my JPAL email or my MIT email in the chat now. And if you're interested in joining and making sure you're up to speed on our new sessions, please don't hesitate to reach out, and we'll get you added to the list. And this is the great idea from Varja, like on our prep call, was this is all fine and good. Like, it's really interesting to hear about these intermediary organizations who are, and also the role of co-impact and taking these steps together with government partners. But let's like also hear the other side of this, like more systematically from government partners. And so that's what Larry and I are going to be putting together next. If you have government partners you think could talk about their perspective in taking these journeys together on institutionalization, again, please don't hesitate to reach out to me. And thanks so much for all the participants. Thanks, that's the QR code to join the community of practice. Thanks again, everyone, for joining, and thanks, Gabby, for putting up with us despite the real challenges there. So thanks. Take care, everyone. Have a good rest of your day and good start.
Thanks, everybody.
Great. Thank you.